are wearing eyeglasses and you want to achieve clear vision without undergoing LASIK surgery, try orthokeratology. In this video, I will discuss about how orthokeratology works, what makes it different from LASIK, and how much it costs. What is orthokeratology? Orthokeratology is the non-surgical process of reshaping the cornea, which is the outermost transparent covering of your eye. What makes orthokeratology different from LASIK, PRK, and other refractive surgery procedures? LASIK and PRK surgically reshape the cornea by removing some portions of the inner stromal layer of your cornea. Because the stromal layer of the cornea does not regenerate, the change in the shape of the cornea is permanent and irreversible. To have a successful LASIK, PRK, or other refractive surgery method, you must pass these three requirements. Number 1, you should not have any dry eyes. Why? Because the most common side effect of LASIK and the other kinds of refractive surgery is dry eyes. And if you already have dry eyes prior to undergoing a refractive surgery procedure, it can get worse. Number 2, you must have a thick cornea. Why? Because LASIK, PRK, and other kinds of refractive surgery partially remove some of the portions of your cornea. Therefore, your cornea must be thick enough so that even if some of these stromal tissues are removed, your cornea will still be strong enough and it will not suffer from keratomalacia or softening of the cornea. Keratomalacia or softening of the cornea can lead to vision impairment and sometimes blindness. Lastly, your eye grade must be stable for at least the past 3 years. Why? Because if your grade still keeps on changing every 1 to 2 years, then you will not be able to enjoy the benefits of LASIK, PRK, or any kind of refractive surgery for a long period of time. Chances are, after a few months or a few years, you will need to go back to glasses again because your grade still keeps on increasing. Now let's discuss how Ortho-K works. Orthokeratology non-surgically reshapes your cornea by using corneal molds while you are sleeping. And when you wake up, you just simply remove these molds and you will achieve a perfectly clear vision because of the alteration in the shape of your cornea. How does these corneal molds alter the shape of your cornea while you sleep and without any surgical procedure? Here's how. The outermost epithelial layer of your cornea has a very unique regenerative ability. It always creates new cells. And what happens is when we wear the mold while we sleep, these new cells will follow the shape of that mold. And when we wake up and remove the mold, we will have a fully reformed cornea and our vision will be perfectly clear. Since the epithelial cells of your cornea keeps on regenerating, the Ortho-K effect may be reversed if you stop wearing your corneal molds for a very long period. However, the Ortho-K effect can be maintained as long as you keep on wearing your corneal molds on a regular basis. So what if you forget to wear your corneal molds right before you sleep? Will you get blurred vision the next day? Of course not. You will need to stop wearing your corneal molds for at least 15 days before your cornea goes back to its previous shape. Now let's discuss about the advantages of Ortho-K. Number 1, because orthokeratology is a non-surgical procedure and it does not require any removal of some portions of your cornea, you can have orthokeratology even if you have dry eyes even if you have thin corneas, and even if you already had LASIK, PRK, or other types of refractive surgery. Number 2, because orthokeratology is safer than LASIK, PRK, and other kinds of refractive surgery procedures, you don't need to worry about any incision, you don't need to worry about any downtime or healing time, and you don't need to worry about any kind of surgical complications. Number 3, even if your eye grade keeps on changing every year, every 2 years, you can still undergo orthokeratology. As a matter of fact, orthokeratology is highly recommended for patients who experience progressive myopia, the type of myopia that keeps on increasing every month, every year, or every 2 years. Why? Because orthokeratology is also an effective myopia control method. It can completely stop myopia progression in adults and slow down myopia progression in children. Just like one of my patients, when he first came to me and he was just about 3 years old that time, his grade was only minus 600. But after 6 months, when he came back to the clinic for follow-up, his grade has increased to minus 900. So can you imagine, there's a minus 300 increase in just 6 months. So we started orthokeratology for him. And when we started orthokeratology, his grade no longer increased in about 3 to 4 years. If you feel that orthokeratology is the right choice for you, but you are wondering how much it costs, let me discuss the fees that you need to prepare for. Number 1, pre-ortho-K assessment fees. During this assessment, we're going to measure your ocular parameters. We're going to measure your pupil size, your iris diameter, how well you can see, or how poor your vision is. We need to determine the shape of your cornea using a corneal topographer. So if your doctor has all the facilities in her clinic to conduct a pre-ortho-K assessment, then you can just do all these diagnostic tests within the clinic. However, for some doctors who do not have all the facilities in their clinic, you may need to go to another facility and undergo some of the diagnostic tests and bring these test results to your doctor so that your doctor can design a corneal mold for you. Some doctors would also do a trial fitting. On top of the measurement of your ocular parameters, we can also let you try on and fit some ortho-K molds so that we can assess the fit of the ortho-K mold prior to ordering. So if your doctor only does empirical method or the measurement of your ocular parameters but does not do any trial fitting method, the pre-ortho-K assessment may be much lower. However, if your doctor measures the ocular parameters and at the same time does a trial fitting, this will take more chair time from your doctor and may cost a little higher. Each cornea is unique. Your right cornea will actually differ from your left cornea, and so we need to design a specific mold for each of your cornea. And this will come at a fee. But the good thing is, this assessment is only done at the beginning of your orthokeratology and it is not a repeating cost. The next thing that you need to prepare for is the cost of the corneal molds. So if you're wondering how much orthokeratology costs, it can range from 50,000 to 250,000 pesos. I got these figures from different clinics, not only from the Philippines, but also from other parts of the world. Of course, in my clinic, even if I source my lenses straight from the USA, my price is adjusted for the Philippines and will cost much lower than what you will pay for in the US, even if you will be using exactly the same corneal molds, and even if your corneal molds will be coming from the US. How often do you need to change your corneal mold? Every year. What most people don't know is that corneal molds have different kinds of materials. So they also have different replacement schedules. One of my orthokeratology patients came back to me after the pandemic and she told me that she's been using the same corneal molds for approximately 5 years or more. and she has never had any kind of vision problem or any kind of eye irritation. I'm so happy with the type of material that I use for her, and she was so happy that she did not need to keep on replacing her corneal molds. So even if it was a little more on the expensive side, she felt like she saved more in the long run. I advise my patients to replace their corneal molds according to the material that we've used for them and according to the actual condition of their lenses. I would also need to determine their eye health if there's any kind of irritation that's developing from the use of the same Ortho-K molds. So if their lenses are in very pristine condition, we don't have any kind of problem, then I don't see the need for any kind of replacement of their corneal molds. I always advise my patients, whether they are Ortho-K patients or whether they are eyeglasses patients, to visit my clinic every 6 months. And that is because I need to monitor their glasses, their Ortho-K, and their eyes. So I think when it comes to the replacement of your corneal molds, it should be according to your doctor's advice. I hope that through this video, I am able to educate you about your options for vision correction. Bye!